Now, what if you're missing just like a front tooth? Why a dental implant over traditional dentistry?
Well, the best thing about a single front tooth is that a lot of times people don't have big crowns or fillings on the teeth on either side, so shaving down 2 teeth for a bridge, one on each side, just because we need room for a bridge, it's kind of really, for me, it's kind of difficult to tell a patient to do that. We don't do a lot of bridges in our office because of that reason. A dental implant is going to stimulate that bone where the tooth is going to be missing for the rest of that patient's life. It's going to feel and look just like a real tooth a lot of times. So we're able to make it look really close to what you would feel like a tooth would. A lot of times, when you're on the lecture circuit, you see a lot of people showing lots of pictures of the restorations and everything. And a lot of times it's hard to determine where the tooth is and where the implant is. So we can provide a great service for someone who's missing just one tooth, and it's something that I think is much superior to a bridge.
And that single tooth, I mean, that could last, it's like getting your own tooth back. That could last as long as you
it could
have your teeth.
It could last your entire life. A lot of times an implant, you can't get a cavity on an implant, never need a root canal on an implant. So it eliminates a lot of these things. And
how long do bridges last?
I would say a bridge lasts anywhere from 5 to 15 years, depending on someone's mouth. And it could last, people will say, I've had this bridge for 30 years. So that's true. Those are always going to be people that are a bit outliers and anomalies. But in general, bridges only last in that range, roughly.
So it may be less expensive in the long run to just get a dental implant?
An implant is almost always less expensive in the long run, almost always. Absolutely.